because really it's what people refer to as single payer is by and large a Medicare system for the whole country. I just don't. I mean, I agree that people. I mean, if the Canadians were unhappy with their healthcare system, you'd hear Canadian politicians, especially conservative ones, running to dismantle their healthcare system, and you don't. So that tells me everything, no matter what anybody says about the Canadian system. It works for the Canadians, as people's healthcare systems in most countries seem to work for them. We rank. We spend twice as much as any other country in the world per capita on healthcare. Yet our outcomes are worse than most in terms of infant mortality, in terms of life expectancy, in terms of maternal mortality, a whole bunch of issues like that. I just think the politics are such that the best we're going to get is our public option. I think we do the public option right. It's not Medicare for all, it's not single payer, but it's something that gives every American the opportunity to go into a public plan if they choose. It will also make the private plans work better, and I've clearly have a record of being no fan of private health insurance, but I also saw what happened 15 years ago when President Clinton in those days introduced into a pretty awful student loan market where the banks ran everything and students were paying too high prices, were getting lousy service. When the president introduced the direct loan program, people could go straight to the government and get a direct loan, student loan. It made the private plans behave a whole lot better. And you know, the private insurance is always one step ahead of the sheriff. I mean, they really do figure out you're healthy, you're not. They cover you because they can make money. They don't want to cover him because they can't. And those days have got to be over. Having the public plan option will make sure those days are over.